Hello, my name's Tiffany. I am a dental hygienist, and today I'm actually responding to a question I had on one of my other videos. First off, though, thank you so much for reaching out and for asking the question. I love these questions and these conversations because it really helps me dig into the research and learn. It was a fellow dental hygienist. Her question was for me to make a video that explained exactly how to put on and take off gloves, especially with a tighter fitting glove. She mentioned that her office has mandated this to reduce the risk for germ transmission. And so I had to go to the science. I had to say, is this an actual thing? Because logically, I can understand if there's less space between the glove and the hand, there's less room for bacteria to get in there. But is there scientific evidence for it? And unfortunately, or fortunately, I'm not sure yet, there isn't. There was a study in Frontiers of Oral Health, and it looked at perforation risk for gloves depending on size. So it compared loose, well-fitting, and tight gloves. And it found that a well-fitted glove has about a 20% risk of perforation. Meanwhile, the tight-fitting glove had a 37.8% risk. That's almost double.
Sorry to interrupt. It's important for me to note that this study was done with latex gloves. And I know most of us are using nitrile to just avoid the whole allergy thing, but unfortunately there isn't an equivalent study done on nitrile gloves, so this is the best we got. The one thing it does mention in the study is that latex gloves have shown better resistance than vinyl or nitrile. And when I read that, it makes me assume that the perforation risk would be even greater with nitrile than the latex that's in the study. Just wanted to make that clear.
What we know is so important in reducing germ transmission with gloves is hand hygiene, technique of taking them on and putting them off. That's not how you say that. Putting them on and taking them off, and hand hygiene again. And so in this video, I'm going to demonstrate how we put on and take off our gloves, how we look for proper sizing, and what happens if we're wearing too tight of gloves. When looking at gloves, we need to imagine that the outside of the glove is contaminated and the inside of the glove is clean. So in putting on, we're going to grab the gloves at the cuff. We're going to slide our hand into the glove, pulling it all the way up nice and smooth, and then we're going to grab the glove, pull our other hand on nice and smooth. Doffing our gloves, which is taking the glove off, is the moment where we have the highest risk of contamination. What we're going to do is you're going to grab your glove, pinching it at the palm and pulling it off. Nice like that. Then you're going to grab the glove in your palm. Slide your finger underneath the cuff of your other glove and pull it over. So this now means that the clean side is on the outside and all of the contaminated stuff is on the inside. And the most important step is that we throw the glove in the garbage immediately. Putting our gloves back on is actually a breach of infection control protocol. Once you take a glove off, it goes in the garbage. You grab a new glove. But then I want to change the subject to looking at what does wearing too tight of a glove do to the hand. Dental hygienists are amongst the highest risk for musculoskeletal disorders. And so this absolutely is an important part of the whole conversation. How does it actually affect the body? A tight glove is like a resistance band that you have to push through to be able to do the movements that are required for our work as dental hygienists. The bright pink glove is a size small, and the light pink glove is a size medium. It requires me to really stretch my hand in order to flatten the glove out. So even though the fingers are actually a little bit looser in my medium-sized glove, this is still the proper fitting glove. How loose that one is and how tight this one is, it's ribbed all the way around my palm here. This glove is too small, and this glove is the right fit. And so put that patient after patient, hour after hour, day after day, those muscles are on fire. They are working so much harder. And so I really encourage you to try and find the best fitting glove for you, because there's no science showing that there's less contamination risk in a tighter fitted glove. And there is science showing that a tight glove is creating much higher risk for you and developing musculoskeletal disorders. So if you're in an office that is mandating these types of things about glove sizes, I really hope this video gives you the language and evidence to have the conversation with your team. You're not being difficult, you're being evidence-based, and that is how we make decisions in this world of dentistry. Thank you so much for your comments. Share with a colleague to help them protect their hands as well, and I hope you have a really wonderful day.